Right, so good morning, my name is Chris Herbert, I'm Operations Director for Research and Innovation. I'm going to come back to this side of the stage for this side of the room now. And what I want to do is talk a bit about how we're supporting innovation from within the hospital. This is a really important part of what's going on in the city at the moment. For those that don't know, Leeds Teaching Hospital is one of the biggest trusts in the country. 1.4 billion pound budget, 20,000 employees, a centre of excellence for specialist services in oncology, neuroscience, trauma, cardiology and children's hospital, 7 sites across the city, and a growing research and innovation powerhouse as well. In the last 4 years, we've recruited over 90,000 patients into research in the hospital. That makes us the second biggest acute trust for recruiting into research in the country. And if you look at commercially sponsored research, we're the #1 organisation for doing that. The Innovation Pop Up is just one of the departments within research and innovation, and we set this up 3 and a bit years ago because NHS trusts are really bad at reaching out proactively to industry, but they're also really bad at supporting and training their staff in how to do innovation and what actually is innovation. And we set it up really with a big ambition. It's about making Leeds Teaching Hospitals and strategic partners global leaders in translation, adoption, scaling and spread of health tech innovation. So we're really looking at this translation. We're not so much looking at invention. Actually, we're looking at high quality evaluation and then that rightward spread. How do we get it into the system and out to the other side again and to other partners in the system? That's where we feel we can really add value. And if we can do this and do it really well, we can help make Leeds that really compelling destination. So we're just one of these cogs in the wheel of the system in Leeds that is really helping move the health tech ecosystem forward, working in partnerships. And partnerships and working with partners is a really important bit of how we work. We can provide access to patients, provide access to clinicians and the expertise in the hospital. We then work with the rest of the ecosystem to bring in the other expertise. And we're doing this for a lot of reasons, but one of the main ones is around the new hospitals and the innovation village. Now, V, I'm hoping this is where the technology might work, and we've got a bit of a fly through here. Do you want to click on that play button, fingers crossed? Do you want to hit play?
I have.
It's working. It was. You know, this is a victory seeing this actually working, technology. So this is going to just, over the next couple of minutes, walk you through what's happening with the new hospital development in the centre of Leeds. We've heard mentioned before the innovation arc. So this is a district across the city that's working from the north of the city where the university is, right through to the south bank. This is the Leeds General Infirmary campus as it stands at the moment. And what you see here is where the new hospital is going to be built, on that bit of space there. These are the 2 wings of the hospital that are going to be demolished once that new hospital is built. And then as you see here, what is being created here is a whole new area of innovation buildings. So this is 5 hectares of land that's being released by these new hospitals, which will then be turned into innovation estate. This is a bit of a walkthrough of what it might look like, and I'll probably, in the interest of time, skip on, but this is available on YouTube for people to look at. But this is about releasing 5 hectares of land for innovation space. And what the pop-up is doing is acting as the how do we switch to the next slide, V? It's acting as the catalyst for how industry based in the innovation district will really work and engage with staff in the hospital, and through that team then help also connect into that wider city ecosystem as well. If I had more time, I'd be letting the video run. Yes. Fantastic. So the pop-up really is the first of 3 phases. The pop-up is just a room. 3 years ago, it didn't exist. It was a derelict bit of space in the Gilbert Scott building. But we saw the potential and said, great, can we have that, please? Just remove the junk out. We'll put a nice floor in, give it a lick of paint, and Bob's your uncle. And what we're using it for is space. Companies can come in and work there. We work with about 40, 50 companies at the moment. Any of the companies we work with who are members can come in and have a hot desk. They'll come in, work. It gives them a base in the hospital to come and sit, work collaboratively with partners. We've had a 3D printing company in there. They've actually been 3D printing joints to help plan operations, which has been fantastic. We've had surgeons in scrubs coming down, planning operations in the pop-up, and then going back and doing those operations because they've planned it using the 3D printed elements that have been printed there. We're using it to support innovation culture as well, and this is all about staff engagement and working with staff and giving them experiential learning on innovation. I'll talk a little bit about that anymore. And we're working really closely with business. We're really proactive about going out to market, understanding what innovations are out there and looking at how do we work with that in the hospital? How could that benefit our patients? How can that benefit our services? And then some of those businesses have said, brilliant, we're going to come and work in Leeds. So Little Journey is a company we've worked with. As Barry said, they're now based in Nexus. There's a number of Norwegian companies we've worked with. They're also now based in Nexus in Leeds. I'd love a big office building to put them in. That's a couple of years ago when the old medical school is converted to an innovation centre. But as well as sort of the research side, we're trying to work through some of the barriers to adoption in the NHS. So how can we improve adoption of technology into our services? Where are the touch points we need to make from within the organisation to accelerate that pathway? And we recognise that the NHS really needs to work with other sectors. We don't invent in the NHS that much. We rely on industry, we rely on academia to come up with the innovations that are going to improve our services. So we really are, collaboration is at the heart of this. So working out how, refining concepts, helping people understand patient pathways, and creating this community of businesses, academics, industry, working together around defined problems, defined areas to say, how do we move these technologies forward? How can we get there? But also bringing people together through communities of interest, through innovation clubs, through other forums like that to share and exchange ideas and really create this blurred boundary of working between industry, NHS and academia. So I just wanted to touch on some of what we do. So for NHS staff, we provide innovation training. 3 years ago, we identified there's actually no proper innovation training out there for NHS staff. So we went and created some. We've trialled it with some of our own staff. We've run it again, and now we're running it again. And this time, we're not just running it for our own staff, but we've got staff from Bradford Hospital, Harrogate involved as well. And others around the country have spotted what we're doing and said, hang on, we really like what you're doing. Can we do it too? Tells us a tick in the box. We're doing the right sort of things here. We help staff with ideas, look at those ideas, provide some IP advice, market assessments, IP protection, help them along that commercialisation journey where that's the right thing to do. We run some innovation events, we help them understand needs and problems, and all sorts of other things that we do for our own staff there to really help them innovation. But we're big on experiential learning from innovation. The way to do innovation, the way I love doing it, is actually giving people a project, getting a collaboration going, introducing them to industry. How would you work with this? And often we'll work with people who in the trust who haven't worked in that way before. So we're starting to build our internal capacity for doing innovation, doing research through that experiential learning. And that's really, really important. So we look to build a culture of research, a culture of innovation across the organisation. And then we provide a lot of support for businesses as well, helping them connect with our staff and infrastructure. So how they do code development, how they do evaluations, how they produce high quality evidence, how do they use that really powerful research infrastructure we've got in the trust that can recruit patients into well-designed, well-run trials to generate that really good evidence that will help with adoption. How do we help them understand unmet needs? Engagement with patients. V's already talked a bit about PPIP. Philip's also talked a bit about it as well. Patient needs, how innovations will work for patients, particularly as we move more out into community, more remote diagnostics. How will that work much, much more? We provide access to real-world data sets as well. So within the hospital where we're working in collaboration with people, and I'll give an example at the end, actually we're able to access our data systems, our imaging systems, and pull out custom data sets for AI training, for real-world analytics. It's something we're really hot on. We've got some really good governance around how we do that, but we're doing that more and more and more with partners. It's a really growing stream of work. And a number of other things as well that you can look at as we move forward. Going forward, our real areas of focus are on the screen here. So artificial intelligence is a big one. Everyone talks about it. We need to know how we do AI responsibly in the organisation. But we've also got a particular focus around the use of AI in imaging. So digital pathology, we've had the National Pathology Innovation cooperative established for a number of years. They're really leading a lot of work around innovation in digital pathology. They've set up a national infrastructure for digital pathology into which AI tools can be plugged for scaled evaluations and things like that. So they're really growing and leading a national agenda and a national infrastructure conversation on digital pathology. But within our own radiology services, there is interest from the clinical service on how they utilise artificial intelligence to improve the service they offer. So we've got a clinical advisory board built into that clinical service unit now of people who are research active and people who are not research active as well. But we're using that forum now to screen opportunities that are coming through with new AI tools. Does this look any good? Is it not? What do we need to do? So using some of our AI infrastructure, our data infrastructure, we're able to then release data sets for doing AI training validation. But now we're also bringing in an orchestrator tool that will allow us to plug AI algorithms, it's a really hard thing to say that, into our PAC system for evaluations and clinical trials with minimal effort. So actually we can do these trials in a much more scaled and easy way to provide a much better service to our partners. We really want to utilise our data assets more to help bring more insights into how products are being used in a real world setting. We do a lot more in product evaluation, so helping people not to do clinical trials, but also some of that real world and post-marketing evaluation as well. There's real opportunities to get high quality data in that space as well. We're interested in digital technologies, particularly linked to our new hospitals. Our new hospitals are meant to be digital first, so looking at how we use remote monitoring, real-time tracking of just about anything and everything, and also then VR and augmented reality. We've just launched the Leeds XR Hub, which is about giving out headsets to people to go and try projects on. And utilise that and try and embed that across the hospital. We launched that to about 80, 90 staff the other week. So we've got a real trajectory of work in that space. Really important, some great case studies of impact in that space already. And diagnostics is another area that's come up from our staff as being something that's of real interest to them. So working in the new Leeds Centre for Laboratory Medicine, which is a big new pathology centre that's been built, actually how can we use some of those systems for testing new diagnostics and evaluating those as well. Just finally wanted to finish with an example of one of the projects we've been working on for a number of years. This is a collaboration with a company called Chiron Medical Technologies. They're developing an AI tool for use in breast cancer screening. So we started working with them in about 2018, and this was the first time we ever released a really big data set of images to a company to help train their AI algorithm. So data out there, about 500,000 images that they then used to train their algorithm. With the health economics team at the university, we then did a piece of health economics looking at the value of this. So this is about that partnership working. How do we work in partnership with others to add value to our clients? We've taken this work much, much further. The product is now sort of coming towards market readiness, and we're now in the middle of a 7,000 patient trial within the breast screening service in Leeds. That is the first clinical trial in a breast screening unit in the country of this sort of technology. So really putting us at the forefront of that sort of work. And then finally, I just wanted to say something about how we will work with the HRC, if the thing will work. I've broken the technology.
Yeah. There we go.
Or was it the computer?
Yeah.
There we go. And just working with the HRC, so this is really about partnership between the team that work in the pop-up who are here today and with V and the team that will be coming forward. So really working around supporting the businesses who are working with the relevant areas that we stumble across. Actually, how do we connect them straight into the HRC infrastructure, because that's where the expertise they're going to need is. How do we support with training for NHS staff? How do we utilise some of what we've done to augment the HRC programme? How does the HRC programme work with us as well? And also, providing that connectivity in that wider innovation village, that wider innovation arc. So thank you very much. It's been great to be here. So myself, I'm around today. The team are around as well. So please do come and talk to us if you want to know more or work with us. Thank you.